Hi, this is Dr. Michael Ryan. I'm here to talk to you about what a vein condition is, what exactly goes on with it. And the bottom line with a vein condition is it's very common, about 1 in 3 people has it, and it's a circulation condition. The circulation slows down. The way that happens is the veins in your legs have little tiny valves that prevent the blood from rushing back down to your calf and your foot when you're standing or walking. Those valves stop working and the blood then begins to pool under pressure in your legs. It hurts, they're under pressure. And because the blood's not flowing well, your circulation slows down. Because of the stagnant blood, the body reacts by creating an inflammation reaction, which causes all of the leg symptoms, as well as probably the most common symptom we see, which is generalized fatigue. People feel wiped out and run down. But the symptoms they experience are usually below the knee, in the calf and foot. It includes aching, fatigue in the legs, numbness, tingling, burning, stinging, itching, cramps, restless legs. Those are the common symptoms in the legs. They can be in the thigh as well, but usually below the knee. And when people have these symptoms, there's a typical pattern we look for. The pattern is that the symptoms are usually below the knee. That's where all the pressure is and the abnormal circulation. That's not 100%, but that's most people. And the symptoms are always worse at the end of the day, late afternoon, evening, and we look for that because that's the inflammation reaction building up in your body. Other patterns that we look for is that people get some relief when they elevate their legs. That takes the pressure off the legs. For people that have tried compression stockings, most but not all indicate that there is some benefit, some improvement. That's a good clue that this is a vein condition. Finally, the other pattern that we look for is that people that have a vein condition that are able to sleep flat in bed at night notice that by the next morning their legs feel better. Maybe not normal, but their legs feel better. And then the cycle starts all over again when they get up and move around and walk. So people wonder, where does the vein condition come from? For most people, it comes from a family member. It's a genetic condition. It's not a dangerous condition. People typically do not have any risk of dying from a vein condition like this. So if you want to, you can continue going along just the way you are. You have to understand that a vein condition gets worse every year. It doesn't stay still. That means more aching, more fatigue, more visible veins. And eventually it begins to slow people down. So it's not a life-threatening condition, it's a health-threatening condition, because as it begins to slow people down, they end up avoiding activities, they're slowing down, they're not as active. And we see quite a few people that actually gain weight. That's a typical pattern that we see. The average is about 10 to 15 pounds a year, and it's because after work or at the end of the day they find a chair and they just sit around for the evening. They don't really want to do anything. That's a very typical pattern for a vein circulation condition. So it does affect people's health by low activity and weight gain. So when people have a vein condition, they wonder, how do I know I have it? And one of the misunderstandings for not only patients but a lot of providers as well is that a vein condition is always associated with visible veins. And actually just the opposite is true, which is that 80% of people, there's no visible abnormal veins, and you have a vein condition. And the reason for that is the abnormal veins that are causing the problem are under the skin. Those are the ones that are really causing all the symptoms and the abnormal circulation. And those are also the ones that are going to benefit from treatment. How do we know that? Well, the diagnosis is made with an ultrasound. An ultrasound allows us to look under the surface of the skin. It's a painless examination. It takes about 45 minutes to an hour. And we look at all of the veins and find out which ones are normal, which ones are abnormal. That allows us to map out what the treatment's going to be. So when I see you in the office in a consult evaluation, I will review your ultrasound, listen to your story, look for that pattern that I just described, examine your legs, and if necessary, I will do another limited ultrasound, and that will allow me to see if there's any other areas that might have been missed during the initial ultrasound. The bottom line with an ultrasound, by the way, is that it's a snapshot in the day, and sometimes the vein problem can be visible, and sometimes it's visible later in the day. So I may take another look while you're in and then I'll tell you whether I think your symptoms are related to your veins and whether a treatment will help. So this is Dr. Michael Ryan with Missouri Vein Care.